Oh my God, I was going to have an auditory seizure, I think, from that. Well, thank you. Thanks very much for having me, and thanks everyone for listening. As I watched that intro, it really struck me that when the narrator said that the problem is not druggable, but it is foodable, donuts were up on the screen, and I think that's kind of a problem. That's not the food we're talking about today, but you'll see why. All right. Well, yes, it is true. I did write this book behind me called Metabolical. And this book is half science and half expose. If it were a Hollywood tell-all, we would call it a kiss and tell. But because it's about diabetes, it's really a piss and tell. And you'll see why as we go. The goal here is to debunk the myths of chronic disease and explain to you what's really going on in order for you to be able to, number one, take charge of your own health, and number two, actually use your voice to try to fix the problem as it exists at many levels: big food, big pharma, and big government. So with that, I'm going to go ahead and share my screen, and let's go into presentation mode. Okay, there we go. All right, so let's start with some statistics. This is a paper that came out in the year 2001, and it looked at the data that existed on type 2 diabetes around the world in the year 2000. And at that time, there were 151 million diabetics stalking the earth. And what was projected for a decade later, 2010, was that we would then be up to 221 million. That's a 46% increase, or an annualized inflation rate of 3.88%. This is not what we saw. What we actually saw was that we, instead of 221 million, we actually had 285 million. And that's an annualized inflation rate of 6.55%, a doubling over what was anticipated. By 2014, we were up to 422 million. That's an annualized inflation rate of 10.3%, a tripling over what was anticipated. By 2019, we were up to 463 million. And now what is projected for 8 years from now, 2030, is 578 million. And this is all during the period of time when we understood that we had an obesity epidemic, that we understood that we have a healthcare crisis, that we have a climate crisis, and clearly nothing's being done about it. Things are only getting worse. WTF. You know, you could actually make the case that doctors cause obesity and diabetes. And actually, that's not far from the truth. And I will explain why. And it's not just adults. You know, that was all adults. Now we're looking at children here. And you're looking at type 2 diabetes by race and ethnicity in the 10 to 14-year-old age group and in the 15 to 19-year-old age group from 2001 all the way up to 2017, so blue to orange. And you can see that it doesn't matter which demographic you look at, things continue to get worse over time. Now, this is taking its toll because you can see health expenditure costs here on the x-axis against life expectancy on the y-axis. And you would think that the more money you throw at it, the longer you would live. Well, here are all the OECD countries, the 37 developed countries, and how they're doing in terms of health expenditure versus life expectancy. They're all kind of bundled up here in the center. But take a look at the US. I mean, we have just completely gone off the rails. We spend more and get less. And for the last 4 years in a row, we have seen a decline in life expectancy because of chronic metabolic disease. Now, the money is not going to hospital costs here in red. The money is not going to physician costs here in green. It's not going to pharma costs here in purple, because if you add all these up, they do not add up to the total costs because the rest of it is going to the care and treatment of chronic metabolic disease, of which diabetes is the sentinel disease, but there are many others. There's hypertension, dyslipidemia, cardiovascular disease, cancer, dementia, fatty liver disease, polycystic ovarian disease. These 8 diseases form the basis of what is basically gutting healthcare around the world, and particularly in the United States. 75% of all healthcare dollars are now spent on 8 diseases, and they are all diseases of energy metabolism. So we have to face 2 inconvenient truths. And right now, we are not facing them. We don't even know they exist, but here they are. The first, there is no medicalized prevention of chronic metabolic disease. There's only long-term treatment, and that treatment doesn't even work. And the reason is because that treatment is actually not treating the disease. It is treating the symptoms of the disease. Like giving an aspirin to a patient with a brain tumor because they have a headache. Might help the headache, ain't going to do a damn thing for the brain tumor. The statins for cardiovascular disease, do they work? No. The antihypertensives for hypertension, do they work? They lower the blood pressure. Do they actually prolong life? No. How about the oral hypoglycemics for type 2 diabetes? They lower the blood glucose. Do they prolong life? No. So we are treating the symptoms, and we are causing enormous costs in the process. In fact, we now spend $3.8 trillion a year on medical care, of which 75% is chronic metabolic disease, of which 75% is preventable if we could go back to the rates of 1970, before the obesity and diabetes epidemic reared its ugly head. Second, inconvenient truth. You cannot fix healthcare until you fix health, and we're not. You cannot fix health until you fix diet, which we're not. And you can't fix diet until you know what the hell is wrong. And what we've said was wrong with diet has been wrong itself for the last 50 years, because we have been barking up the wrong tree, and we know why now we've been barking up the wrong tree. And it's a sordid story with some dark forces at the helm. So in order to convince you of these 2 inconvenient truths, I have to debunk and explode for you 3 general myths, 3 belief systems that have basically overtaken all of modern medicine over the past 50 years. And I have to do it in basically an hour flat. So please give me your attention as we go through each one of these myths, and I will dismantle each one piece by piece, limb from limb, until finally just blood on the floor. Here we go. Myth number 1, it's about obesity. After all, everyone says it's about energy balance. Everyone says we eat too much and we exercise too little. Well, that's true. We do eat too much. We do exercise too little. The question is not, do we do that? The question is, why do we do that? And is that the real problem? Or is that actually an epiphenomenon? Is that something that comes along with the problem as opposed to being the cause of the problem? And that's the myth that needs to be exploded. All right, and we're going to take that apart, piece by piece. So on this slide, we have a Venn diagram of the entire adult US population, 240 million adults, 30% obese, BMI over 30, 70% normal weight, BMI under 30. All right. Everyone listening to this talk today is in one of the 2 circles, and you know who you are. All right. And they are mutually exclusive circles. Now, the standard mantra from the doctors and the dietitians and the Institute of Medicine and the National Institutes of Health and the Surgeon General and the White House and Congress and the food industry is the following. 80% of these obese individuals, 80% of 30% of 240 million, these 57 million people here, they're sick. They're fat and they're sick, and they're sick because they're fat. And if they would only just diet and exercise, we could solve this problem. That's what they say. Garbage. Total trash. Immediately disprovable. And it's on the slide. How is it disprovable? Well, it is true that 80% of 30% are metabolically ill. I don't argue that. That is true. However, what that also means is that 20% of 30% are not. They are metabolically healthy. We have a name for them called MHO, metabolically healthy obese. We actually study these patients to try to figure out how come they didn't get sick. Conversely, 40% of the normal weight population have the exact same diseases as do the obese. Normal weight people get type 2 diabetes, hypertension, dyslipidemia, cardiovascular disease, cancer, dementia, fatty liver disease, polycystic ovarian disease too. Now, they get it at a lower rate, true. They get it at 40% instead of 80%. So obesity is a risk factor, and I don't argue that. That is true. But if normal weight people get it too, how can it be about behavior? This looks more like exposure. This looks more like cholera or influenza or COVID-19 for that matter, where people who are sick and people who are not sick are actually in the same family or in the same household. All right. And when you do the math, 40% of 70% of 240 million, turns out there are 67 million thin sick people, calling the 57 million fat sick people the problem. And when you do the math on the two of them together, that's more than half the US population. And that's what makes it a public health crisis. Because if it was just the obese, you could say, well, their problem. But everyone's at risk. Now, not at the same level, but everyone's at risk. And that's what makes it a public health problem. And I will prove this to you again in a different way. Here we have CT scans through the abdomens of two equally weighted people. Notice trunk fat 12.8, 12.8. Okay. One's healthy, one's sick. Which one's sick, A or B? Answer, B. B is sick. And the reason is because A, he's got subcutaneous or big butt fat. You can see here, ASAT, subcutaneous adipose tissue. This is cosmetically undesirable, but metabolically inert. This is actually where your body wants to put extra energy to keep yourself healthy, to be protected. This is metabolically healthy obese right here. This guy, on the other hand, down here, B, he's got fat all around his organs. You can see that, intra-abdominal fat. See? There. And that's the big problem. That's the bad fat. And we have a name for this. It's called TOFI, T-O-F-I. Thin on the outside, fat on the inside, real medical term, 1,500 Medline citations, coined by Dr. Jimmy Bell, a neuroimager at University College London. So my question to you, sitting here right now listening to this lecture is, are you a TOFI? Do you know? Does your doctor know? If your doctor knows, why hasn't your doctor told you? And if your doctor did know, what would they do about it anyway? These are the questions that have to be answered before we can actually get healthier. And I'll prove it to you a third way. Here we have an MRI fat fraction map. You can see the fat very easily here. Here's a normal obese person. You notice the big love handles here on the side. But what I want you to do is I want you to take a look at this guy's liver right here, dark. See it? 2.6% fat. This is perfectly fine. This is a metabolically healthy obese person. This guy will probably outlive you. Now here we have what you more likely see. Obesity, sure. But take a look at this guy's liver. 24% liver fat. This guy's got fatty liver disease. This guy's got metabolic syndrome. This guy going to die. Now take a look at this guy here. Notice no obesity, normal amounts of subcutaneous fat here. But take a look at his liver, 23% liver fat. Thin sick, fat healthy. The point is, it's not the fat you can see that counts. It's the fat you can't. And you don't know if you have it or not. Now, it is true that most of the time, those people with the fat you can see also have the fat you can't. That's true. I don't argue that, but it's not an automatic. In fact, we have fat healthies and we have thin sicks. So which are you? You don't know. So this liver fat turns out to be the most egregious form of fat. There are three fat depots. There's subcutaneous fat, which is protective. There's visceral fat, which is bad, no argument. And then there's liver fat, which is the worst. And it turns out that BMI isn't a good arbiter of whether you have liver fat or not. Because here you can see, even in normal weight, you can see a signal, and overweight, you can see a higher signal. Yes, of course, the obese have the highest amount of liver fat. I don't argue that. But diabetes, take a look. If you have no diabetes versus diabetes, even in the normal weight population, if you have diabetes, look at how much liver fat you have. And it turns out it's the liver fat that caused the diabetes because your liver's not working right, which makes your pancreas have to make extra insulin to make the liver do its job. And that burns out the pancreas. And that's why you end up with diabetes. In fact, in Korea, if you have fatty liver, you are 3.5 times more likely to develop type 2 diabetes in your lifetime. So it's causative. So the moral of the story is that obesity is not the problem. People don't die of obesity. It's not even listed on the death certificate. Rather, metabolic syndrome is where all the money goes, 75% of all healthcare dollars. And here's the list right here. And the ones we are most interested in are type diabetes and non-alcoholic fatty liver disease, which I have shown you. So I hope in 10 minutes that I have debunked myth number one. It is not about obesity. Rather, it is about metabolic dysfunction, of which diabetes is the sentinel disease. And it turns out that 88% of Americans have metabolic dysfunction. 88%. Only 60% are overweight or obese, but 88% have metabolic dysfunction because there are plenty of thin people who are sick too. Which leads me now to myth number two. And this is the myth that I am going to drive the final stake in the heart of. Okay, and we just published a paper today that is the final nail in the coffin. Okay, never to rise again. Dracula is now dead. Okay, this paper just came out in Biochemical Pharmacology 12 hours ago, and it is about obesity and obesogens. That is, chemicals that cause obesity having nothing to do with calories. But the myth is, well, it's about calories. And if it's about calories, then it's about energy balance. Therefore, if you're fat, it's your fault. Therefore, diet and exercise. Therefore, any calorie can be part of a balanced diet. Therefore, don't pick on our calories, go pick on somebody else's calories. That's what the food industry tells us. And if it were about calories, they'd be right. But it's not about calories. That's exactly what's wrong. So let me show you what I mean. Here we have a picture that I took in a Rome restaurant window. And here you have Italian steak. And here you have Argentinian steak. And down here we have US grade A prime corn-fed beef. What do you see? You see marbling down here, right? These guys, red and homogeneous, but down here we see marbling. We prize our steaks for being able to be cut with a butter knife. And this is where all the flavor is. And so American steaks are prized the world over. The question is, what's this versus what's this? And the answer is, these animals were fed on grass in the Mendoza Valley. Argentina, Mendoza Valley. These guys were fed on corn-fed beef. This is intramyocellular lipid. This is fat in the muscle. And this is what your muscles look like, because this is metabolic syndrome. We just kill these animals before they get sick. These animals go from birth to slaughter in 18 months. These animals go from birth to slaughter in 6 months. Cash flow. How about this? Which egg is the healthy one? The one on the right or the one on the left? Turns out the one on the left. Because this hen ate grass. This hen ate corn. Why is this yolk orange and this yolk yellow? Answer, omega-3s. Omega-3s. Omega-3s are anti-inflammatory, anti-Alzheimer's, anti-cardiovascular disease. But this is a store-bought egg. This is a pasture-raised egg. Turns out, everybody thought the problem was saturated fat. Everybody thought fat was the bad guy. Well, turns out not so much. So here we have what's called the Prospective Urban and Rural Epidemiology Study, or the PURE study, that came out in 2017. And Salim Yusuf was the first primary investigator. And you can see here, we're looking at total mortality and cardiovascular disease based on energy from fat. If the curve goes below the horizontal line, it's protective. If the curve goes above the line, that means it's causative. Notice, energy from total fat, protective. Energy from saturated fat, protective. Energy from monounsaturated fat, protective. Energy from polyunsaturated fat, protective. Only energy from carbohydrate is causative. Turns out it's not the fat, but we've been saying it's the fat for the last 50 years. We've been saying saturated fat is the bad guy. Well, turns out there are two kinds of saturated fats. There's red meat saturated fats and there's dairy saturated fats. And it turns out that dairy saturated fat is not the same as red meat saturated fat. Red meat saturated fat are 16 carbon or 18 carbon fats, all right? And dairy saturated fats are odd chain, C15 or C17, and they have a specific phospholipid signature on the tail, which actually turns out to be protective against diabetes and heart disease. As you can see, the curve below the horizontal line for each of these. So it turns out when we went low fat in the 1970s, we actually took out the protective fats as well as the fats that maybe aren't as good. How about surrogate markers like, for instance, LDL? Now, everybody says LDL is correlated with cardiovascular disease. That's true. It is. All right. And here's the diamond that shows the meta-analysis. And you'll notice the hazard risk ratio for high LDL and heart disease is 1.3, meaning if you have a high LDL, you have a 30% increased risk of dying from a heart attack. True. Now, the public health community says 1.3 is the cutoff point. Less than 1.3, not a public health issue. 1.3 or greater, public health issue. So LDL is like right on the button, right on the edge. And you can see here the diamond does not cross 1, so it is statistically significant. And I don't argue this. This is true. However, there is a lipid that is much, much worse, and it is called serum triglycerides, okay, which you also get on your lipid profile. And you'll notice the hazard risk ratio for triglycerides and cardiovascular death is 1.8. You can see right here, 1.8, okay, much higher, all right? Turns out that triglyceride is a much bigger problem than the LDL ever was. But we've been treating the LDL, not the triglycerides. We've been treating LDL with statins. Do they work? And it turns out you have to look at the data really carefully. For secondary prevention, that is, if you've already had a heart attack and you've already declared yourself at risk, then statins do lower your risk for a second heart attack. That's true. But for primary prevention, that is, giving people statins because their LDL is high, like you go to your doctor when you're 40 years old and the doctor does your blood test and says, yeah, your LDL is 150. Maybe you should take a statin. Turns out the data for that is absolutely zero. Zero right there, zero. Okay. And there's another paper that just came out like a week ago, which redid all these analyses even tighter. And turns out that the increase in longevity from being on a statin for primary prevention is 4 days. You get 4 days out of a statin. Randomized control trials of drug or dietary interventions, no benefit on mortality. Most of these trials did not reduce cardiovascular events, and some of the drug studies actually reported harm. Like, for instance, diabetes. Here's the diamond for diabetes and statin use. 20% increase in diabetes among statin users. And the reason is because the statins are actually poisoning the mitochondria. It's one of the reasons they work. My colleagues, Asim Malhotra, who is a member of the National Health Trust in the UK, Rita Redberg, who is the editor-in-chief of JAMA Internal Medicine, and Pascal Meyer, the editor-in-chief of BMJ Open Heart, not exactly lightweights in this field, wrote this editorial back in 2017. Saturated fat does not clog the arteries. Coronary heart disease is a chronic inflammatory condition, the risk of which can be effectively reduced from healthy lifestyle interventions. And what they said is that the big problem is insulin resistance, which leads to systemic inflammation, which causes the coronary disease problem. And what is driving that? Excess sugar, fructose specifically, and refined carbohydrate. Indeed, because the carbohydrate is what increases mortality. And the reason is because it induces insulin resistance. And insulin resistance, as I told you at the beginning of this talk, is the thing that is underneath all 8 of those chronic metabolic diseases. The type 2 diabetes, the hypertension, the dyslipidemia, the cardiovascular disease, the cancer, the dementia, the fatty liver disease, the polycystic ovarian disease. The 88% of people in America who are metabolically ill, they have insulin resistance, and they have it because of the excess fructose and refined carbohydrate consumption, not because of the saturated fat. So can we prove that? Well, yes, we can. In fact, we did it, our group. Okay, these are 3 papers. We now have 5 in the literature on this topic. One just came out a week ago. Turns out, you know what sugar makes in your liver? Earwax, ceramides. And ceramides are famous for being inflammatory. All right, and sugar generates ceramides in your liver. So here, what we did in this study was we took 43 children from our obesity clinic at UCSF, ages 9 to 19, Latino and African American, all low socioeconomic status, all processed food and high sugar consumers. And what we did was we figured out what they were eating on their home diet. We studied them on their home diet. And then we catered their meals for the next 9 days. We supplied their food. We supplied it to give them the same amount of protein, the same amount of fat, the same amount of carbohydrate, the same amount of fiber. The only difference was we took the sugar out and we put starch in to replace it. We kept their weight constant over the course of the 9 days. Okay, and here's what happened. We gave them a scale to make sure that they didn't lose weight. And you'll notice the change in subcutaneous fat, no change because they didn't lose weight. The change in the visceral fat, the belly fat, down 7%. But look at the change in liver fat, down 22%. And take a look at their glucose curve before and then after the change. An improvement, basically more glucose tolerant. And here are the insulin levels. Here's insulin resistance because the insulin's not coming down. And here's, even though we're giving them more glucose, because, we took the sugar out and put starch in. That's more glucose. They are now insulin sensitive. And the reason is because now their liver works better. So in cartoon form, here's what was happening at baseline. Okay. They had fatty liver and they were making serum triglyceride, VLDL. Okay? And after 9 days of sugar restriction and starch supplementation instead, their liver fat went down 22%. Their turning sugar into fat went down 46%. Their triglyceride went down 49%. Their visceral fat, belly fat, went down 7%. And their pancreases started making insulin properly because the liver fat went away. In other words, we reversed their metabolic syndrome with no change in calories and no change in weight. Again, proving a calorie is not a calorie. Because if it comes as sugar, it's way worse than the calories. But there's something else that also is a problem with processed food, aside from sugar, the lack of fiber. Turns out the quality of the carbohydrate, whether it comes with fiber, has a major effect. So here you can see blood glucose levels in type 2 diabetics on a standard diet and on a low-carb diet. This is one of the reasons why people advocate low-carb diets, is because they don't generate an insulin response, and they can actually lower blood glucose because you're not giving the glucose by mouth. That's true. But take a look here, same graph I showed you before, but now with another study where they gave a high fiber diet. Okay, they didn't take the starch out. Whoops, sorry. They didn't take the starch out. All they did was give that carbohydrate with fiber, and basically they got almost as low a glucose excursion because they got the insulin down by giving high fiber as by giving low carb. Okay? Now it turns out the fiber is necessary because the fiber is the food for your microbiome. The fiber allows your bacteria to turn that microbiome into short chain fatty acids, acetate, propionate, butyrate. These are actually helpful to us. Even though they're metabolic byproducts of the bacteria, they are anti-inflammatory, they are anti-heart disease, and they are anti-Alzheimer's. You need the fiber in order to feed your gut. And you can see fiber consumption here on the x-axis predicts a reduction in all-cause mortality, coronary heart disease, type 2 diabetes, and colorectal cancer. More fiber, more better. But processed food is fiberless food because you can't freeze fiber. Ultimately, the goal is get the insulin down. And anything that makes the glucose go up or anything that makes the liver store fat is going to make the insulin go up. Refined carbohydrate, sugar. Refined carbohydrate, sugar. These are the bad guys in the story, but these were not the target of the last 50 years. This paper looks at the problem a different way. This was done by my colleague Jim Johnson at UBC, and he did a brilliant thing. What he did was he developed a transgenic mouse that had only half the insulin. Only half the insulin, only made half the insulin. Now you would say, well, half the insulin, that animal should become diabetic. No, not true. In fact, not only did these animals not become diabetic, they also didn't become obese, and they also ended up living much longer. They had lifespan extension because insulin is the bad guy in the story. And anything you can do to get the insulin down will actually increase your lifespan. Insulin is the problem, and getting the insulin down is the solution. And you can do it with diet. So myth number 2, debunked. It is not about calories. It never was. Rather, it's about insulin. Get the insulin down any way you can. And that's what we did at UCSF in my clinic for 15 years. We were not an obesity clinic. We were an insulin reduction clinic. And we had to figure out in every case, what was the reason for the patient's high insulin, and then attack that. And then the patient got better. And not everybody had the same reason for their high insulin. Okay, so you needed some, shall we say, medical expertise. But insulin reduction is the goal. That's the primary therapeutic goal. Get the insulin down by resolving the insulin resistance and reducing the insulin release. And the way to do it, reduce sugar and refined carbohydrate, because that's what makes insulin go up. Increase soluble and insoluble fiber, because that's what keeps insulin down. Well, you need a low sugar, high fiber diet. That's called real food. Problem is, that's not what the food industry is selling. They're selling a high sugar, low fiber diet. That's called processed food. And that brings us then to myth number 3. Myth number 3. It's very American. It's about personal responsibility. It's your own damn fault. You got fat, it's your fault. Okay, that's, it's like almost, like synonymous with America. Your own fault. Take the risks, suffer the consequences. So here's my question to you. Is personal responsibility in the Constitution? Is personal responsibility in the Declaration of Independence? Is personal responsibility in any state house legislative charter? Is personal responsibility in the Magna Carta? Is personal responsibility in Hammurabi's Code? Is personal responsibility in anything that even resembles a governmental edict? No. Personal responsibility is an ideology. Okay? It's an ideology. Now, in order to exercise personal responsibility, you have to satisfy 4 criteria. That is, you must have knowledge of what you're doing. If you don't have knowledge, how can you exercise personal responsibility? Well, here are the 56 names for sugar. And actually, it turns out there aren't 56, there are 262. And if you want, you can go on the Hypoglycemia Support Foundation website, and they have all 262 names of sugar for you. Do you know all these? Do you know to look for these? Here's your nutrition facts label. Notice something. See this purple column here? This is the percent daily value. This tells you whether or not you've eaten too little or too much. It's got everything on it. It's got fat, it's got salt, etc. Bottom line, there's one thing it doesn't have. It doesn't have a limit for sugars on purpose. Food industry doesn't want you to know, because if you knew, you wouldn't eat any of their shit. Excuse my French. Okay. And the new FDA label was specifically delayed by the Trump administration, very specifically because of this issue. So if you don't have the knowledge, how can you exercise personal responsibility? Second, you have to have access. Well, unfortunately, 40% of America lives in food deserts. And if they live in food deserts, they can't even get fresh food that is low in sugar and high in fiber. Well, if they don't have access, how can they exercise personal responsibility? It'd be like expecting a prisoner to be able to eat well when they can't actually cook for themselves. You have to be able to afford your choice, and society has to be able to afford your choice. And lastly, your choice can't hurt anyone else, because if it hurts someone else, that's called anarchy. So here's my question to you. Is ultra-processed food food? Is it food? It's high sugar, low fiber. Is it food? Yes or no? Well, in order to answer that question, you have to know the definition of food. Do you? Well, go to the dictionary. Here is the definition. And I think this is a fine definition. I have no problem with this definition. Substrate that contributes either to the burning or growth of an organism. Burning or growth of an organism. I think that's a fine definition. So let's look. Let's look at sugar first. Burning. Turns out, here's a mitochondrion. Okay, this is the energy burning factory inside each cell that makes the chemical energy called ATP that your cell uses to power itself, right? And the way it works is you undergo a process called beta oxidation. That's what happens in your mitochondria. Turns out glucose, okay, which is the energy of life, All cells on the planet burn glucose for energy. Glucose activates two enzymes that make mitochondria work better. Activates AMP kinase, which is the fuel gauge on the liver cell. And it also activates this guy down here, HADH, hydroxyacyl-CoA dehydrogenase, which is necessary to get those fatty acids burned in the mitochondria. So glucose, for lack of a better word, is good. Glucose improves beta oxidation. But how about that other molecule in sugar? Fructose, the sweet molecule in sugar, the molecule we seek. It turns out the molecule that is addictive. It inhibits three enzymes that allow mitochondria to function. It inhibits that AMP kinase. It inhibits this enzyme down here called ACAD-L, acyl-CoA dehydrogenase long chain, which is necessary to start that beta oxidation process. And finally, it inhibits this enzyme here called CPT1, carnitine palmitoyltransferase 1, which is the shuttle mechanism by which fats get into the mitochondria for burning in the first place. In other words, fructose inhibits mitochondrial function. Fructose inhibits burning. Glucose stimulates it, fructose inhibits it. Well, sugar is half fructose. And here's what Ron Kahn, the head of the Joslin Diabetes Center at Harvard, said. He said, the most important takeaway of this study is that high fructose in the diet is bad. It's not bad because it's more calories, but because it has effects on liver metabolism to make it worse at burning fat. As a result, adding fructose to the diet makes the liver store more fat, and this is bad for the liver and bad for whole body metabolism. Couldn't agree more. Remember those 88% of Americans who are metabolically ill? Here's why. And we have proof of that too in the form of a study done by Kevin Hall at the NIH, where he basically randomized subjects to either receive an unprocessed diet first or an ultra-processed diet first, but that were all matched for calories, sugar, fat, fiber, and macronutrients. And it turned out that the ultra-processed food diet caused more food intake than the unprocessed and more weight gain than the unprocessed as well. And the reason is because the mitochondria weren't working. How about growth? So this is work from my colleague at the Hebrew University, Jerusalem, head of the Department of Nutrition. Her name is Dr. Efrat Mansiniga Ornan. And here's what she did. She fed rats a control diet. You can see the nice cortical bone here in red. And then she also fed a different set of rats an ultra-processed food with a caloric soft drink. Notice, no red. Take a look at the X-ray of the control bone against the ultra-processed food bone. It's completely washed out. Take a look at the thickness of the control bone against the thickness of the ultra-processed food bone. Way thinner. Bottom line, ultra-processed food inhibits bone growth. And instead of contributing to bone to growth, what it does is it hijacks growth. It hijacks growth by increasing cancer risk because it stimulates insulin. And insulin is a primary driver of cancer development. Insulin stimulates cancer cells. It's one of the reasons why we got to get the insulin down. Every 10% increase in ultra-processed food consumption increases cancer incidence by 12%. And diabetes too, due to ultra-processed food right here. So bottom line, ultra-processed food contributes neither to growth nor to burning. Therefore, ultra-processed food is not food. Ultra-processed food is actually poison. The main driver is sugar, but the lack of fiber also. And it turns out that 56% of the food sold in America today is ultra-processed and accounts for 62% of the sugar in the American diet and 67% of the sugar in kids' diets. And this is why kids now get the diseases of metabolic syndrome, even though they're kids. They get the diseases of aging, They get the diseases of alcohol because these are the diseases of mitochondria, because the sugar in their diet is inhibiting their mitochondria. And it's not just the beverages. It's not just the cakes, candy, and ice cream. Yeah, it's those. But it's also the fruits and the vegetables, the starchy foods, the meat, fish, and eggs, dairy products, fats and sauces, salty snacks. It's in everything. It's not just the obvious. We showed in an econometric analysis, which is causational, proves causation, that the only thing in the diet that predicts diabetes change country to country across a decade was sugar. That's it, sugar. The amount of sugar in the diet predicted the change in diabetes rates. I wrote this now 5 years ago, Processed Food, an Experiment That Failed. And that's the way we need to look at this. We basically, went off on a tangent. We partly went off on the tangent because we had the ability, and we partly went off the tangent because we were told that saturated fat was the bad guy, and we could get the fat out of the diet. Bottom line, all we did was get sicker and fatter. Here is our consumption of sugar over the past 200 years. All right. So our ancestors getting fruits and vegetables with the occasional honey out of the ground and in the trees consumed about 5 pounds of sugar per year, which is fine. Our livers can metabolize that just fine. Here's the growth of the sugar industry in the 19th century, CNH and Domino and Texas, Louisiana, Hawaii, et cetera. Here we reach stabilization where price equaled demand, so equilibrium. Here's the rationing of World War II right here, and it came back up to the same level. And here's the introduction of ultra-processed food starting in around the mid-60s. And then, of course, we went even higher because of high fructose corn syrup being cheaper and the substitution of sugar for fat because the dietary guidelines told us to eat less fat. So what I'm going to do now is I'm going to overlay on this diagram the percent of gross domestic product in America spent on healthcare for the same period of time. Ready? What do you see? When processed food came into our world in the mid-1960s, that's when healthcare started going off the rails. Food. Ultra-processed food is actually poison because it poisons mitochondria. Do you know what else poisons mitochondria? Cyanide. Cyanide's a poison. If you poison your mitochondria, you are poison, period. And ultra-processed food poisons mitochondria. Harvard says reducing sugar in packaged foods could prevent disease in millions. Indeed. I think we ought to rename type 2 diabetes as processed food disease. Now that's a teaching moment. You have processed food disease. Maybe that'll, get people to wake up and smell the coffee. So then we come to the question, all right, well, that's bad, but what's good? What's healthy? Well, you have to know what the definition of healthy is. So Michael Pollan, in his book, Food Rules, and in his New York Times Magazine article, famously said 7 words, 3 clauses, 7 words. Eat food, not too much, mostly plants. Okay, and I know that a lot of people out there are plant-based. I'm not mad at you for being plant-based, but you got to think about what that means. All right. First of all, let's take each clause one at a time. Eat food. What does that mean? Eat food. Well, some people need a low-fat diet, other people need a high-fat diet. In fact, there are genetic reasons and there are also environmental reasons why some people do better on one versus the other, and that's not really addressed in this statement. Not too much. Not too much doesn't take into account this mitochondrial dysfunction business. And finally, mostly plants. Let me remind you that Coke, Doritos, and Oreos are all plant-based. They're all vegan. So just because you're vegan doesn't mean you're healthy. And just because you're keto doesn't mean you're healthy either, by the way. All right. You can either one can do it wrong. All right. So I don't have a horse in the race. I am not pro-vegan. I'm not anti-vegan. I'm not pro-keto. I'm not anti-keto. I'm not even pro-carnivore or anti-carnivore. I am agnostic. The only thing I'm against is processed food, because it's not what's in the food. It's what's been done to the food, and really what they did to the food. And that's why I wrote Metabolical, because I basically, understand now that this has been a put-up job for the last 50 years, and our food has been contaminated very specifically for profit. And it's not listed on the food label. You can't figure it out by looking at the food label as to whether or not there's actually, whether the food is healthy or not. So I suggest rather 2 principles, 6 words, not 7, 2 principles, two clauses. Protect the liver, feed the gut. Protect the liver from what? Well, mostly from sugar, but also from glyphosate, from heavy metals, okay, they're meant from branched chain amino acids, and feed the gut. Feed the gut what? Well, feed the gut fiber, because fiber is the food for your bacteria, and fiber helps you because it slows the rate of absorption, thereby keeping your glucose down, thereby keeping your insulin down. It also initiates satiety sooner, so you won't eat that second portion. It supplies substrate for your gut to turn into short-chain fatty acids, and it also helps clear cancer cells from your colon. The question is, processed food is not going away. And I'm not even sure we want it to go away, because we have to feed 10 billion people by the year 2050. How are we going to do that if we got rid of processed food? And there's not enough place to grow food if we actually anticipated that everyone would eat real food. So the question is, what are we going to do? This is the big conundrum for the 21st century. How are we going to fix our climate and fix our food all at the same time? So what we have to do is we have to make processed food healthier. Can it be done? And the answer is yes, it can. And we're doing it. In fact, I and a scientific team are working with a company, a processed food company in Kuwait called KDD, Kuwaiti Danish Dairy. They're basically the Nestle of the Middle East. And what we're doing is we've analyzed their entire 176 item portfolio to protect and re-engineered each item to protect the liver, feed the gut, and also, in fact, support the brain with omega-3s. Now, other companies know that this is an issue. Danone and Unilever have actually analyzed their portfolio and have reduced their sugar footprint by 14%. Now, they know there's a problem. Otherwise, they wouldn't have done that. 14%. When we are consuming quadruple the amount that our liver can handle, you think a 14% reduction is going to make a difference? I don't know. I'm a little concerned. That's kind of like a little too late. In the KDD project, we have identified 78% of the added sugar that can be removed, not just safely, but healthfully, in order to actually create healthy processed food. And we are doing this right now. And the World Economic Forum is helping to sponsor this and to help promulgate it as well. This is the Davos people. So I'm going to close with this slide. This was the cover of Newsweek a couple of months ago. Toxic food, indeed. That's right. Ultra-processed food raises the risk of diabetes, cancer, heart disease, obesity, and dying of COVID-19. Because it turns out insulin resistance is a primary driver of inflammation, and inflammation is the thing that you die of in COVID-19, the cytokine response. Processed food is killing us through chronic metabolic disease, and it's also killing us through infectious disease, both. Toxic food is the problem. Real food is the solution. We're working on other opportunities to try to make processed food healthier. I'm happy to answer questions about those during the Q&A, but the bottom line is, until we fix the food, don't expect anything to get better, because it's the food, stupid. With that, I'll close. I'd be happy to answer any questions.
Thank you very, very, very much, Dr. Lustig. That's profound and eye-opening for so many of us. And my name's Ben. I'm with The Real Truth About Health. I just want to make sure everybody knows, before we get into our Q&A, if they want to reach you personally or directly, or if people are looking for your book, where's the best place to reach you?
I'm real easy to find. So I have a website, robertlustig.com, metabolical.com. You can find me on LinkedIn, and I've got a Twitter account and Facebook too. I have an email address. Lots of people find me on email, robert.lustig@ucsf.edu. But probably LinkedIn is probably, the one I check the most.
Okay, excellent. Thank you. And folks, you can see a few of his books there on screen. And with that, we're going to jump into our Q&A. Dr. Lustig, before we jump in, I want to make sure everybody knows how we go about that here. And so many folks do, but in case you don't, we typically do not take questions directly from the chat box. We ask you to raise your virtual hand. If you're not sure how to do that, you look down at the bottom of your Zoom screen and you'll see different tabs. And one of those tabs is called your reactions tab. So you can go ahead and click on your reactions tab. Some different functions will come up and some emojis. You click on the raise hand. We will see your hand raised. I'm starting to see some coming in now. We'll take questions in the order in which the raised hands come into us. I will call your name and unmute you, and you'll have your chance with Dr. Lustig. So with that.
Can I caution the audience? Okay. I am happy to answer questions. I am not happy to listen to rants.
Fair enough. And yes, we ask our audience to abide by that and obviously try to keep your questions short and brief and to the point and on point. So yes, thank you for that. And so let's jump in now with Stephen F. I'm going to unmute you. Hi, Stephen. Welcome.
Hi, Dr. Lustig. That was a great talk. I'm starting to get an idea how you feel about sugar. How do you feel about those non or lower caloric alternatives that we're told are okay or healthy, like inulin for fiber, erythritol for its antioxidants, lucuma, monk fruit, stevia, yacon?
Right.
Considering they all elicit some sort of bioresponse, an insulin response, at the end of the day, you adjust for the calories, so you don't really save any calories.
That's right.
And it seems to adjust my sugar palate. So I crave these things more, even when I use these. And I love them all. What do you think?
Right. So let's start at the beginning. You started with inulin. So inulin is a soluble fiber. Inulin is found in fruit. Pectins, inulin. Okay, these are soluble fibers. These are what hold jelly together. All right. Now, soluble fiber is good, but insoluble fiber is better. Real food has both. Almonds have both. Fruit, real whole fruit, has both. You need both. The way I describe it in the book, think of it like this. You have a spaghetti colander, metal bowl with holes, right? You run the water, water runs right through. Okay, now take a blob of petroleum jelly, throw it into the center of the colander. Now run the water. Water still runs right through. Might bounce off the jelly, but still runs right through. Now take your finger and rub it all the way around the inside of that colander. Now run the water. Now the water doesn't run right through. You have created an impenetrable secondary barrier. Okay. Imagine that the petroleum jelly is the inulin and the pectin, the soluble fiber, which are globular and plug holes. Imagine that the cellulose, the stringy stuff in celery, cardboard, okay? Imagine that that's the colander. And imagine that you have the geometry of the two together in your intestine. So when you swallow a piece of whole fruit or an almond or anything like that, what you're doing is you're generating an impenetrable secondary barrier. The cellulose forms the lattice work, fishnet, if you will. The soluble fiber or globular plug the holes in that fishnet, and it creates a secondary barrier. You can actually see it on electron microscopy on the inside of the intestine, a whitish barrier. And what that whitish barrier is doing in that duodenum is it's preventing early absorption of glucose, fructose, sucrose, simple starches, so that they do not cross into the portal vein and then go to the liver, thus protecting your liver. So even though you consume the sugar of the fruit, you didn't flood your liver because of the fiber. Fiber is good. Now, if you didn't absorb it early, where does it go? Well, it goes further down the intestine. And what's in the middle of the intestine? What's in the jejunum that's not in the duodenum? The bacteria, the microbiome. Now, the microbiome can't live in the duodenum because the pH is too low, because it's still an acidic environment from the stomach. Okay, the pancreatic juice gets released at the sphincter of Oddi to mix with the food to bring the pH back up to 7.4 in the jejunum after the ligament attrites. And that's where the bacteria are. And so what you're doing is you're preventing early absorption, and therefore you're providing that food for your bacteria to be able to chew up instead of you. So even though you consumed it, even though it passed your lips, even though it counted as, quote, calories, unquote, because you ate it, guess what? You didn't get it. Another reason why calories are BS. Because it doesn't matter what you ate, it matters what you absorbed. And if you absorbed it, if you ate it with fiber, you didn't absorb it. Your bacteria chewed it up for its own purposes instead. So fiber is the key to the kingdom. But our food is fiberless food because you can't freeze fiber. I'll prove it to you. Take an orange, put it in your freezer overnight. Take it out in the morning, put it on your kitchen counter, let it thaw, try to eat it, see what you get. You get mush. Why do you get mush? Because the ice crystals macerated the cell wall, let all the water rush in. Hey, food industry knows that. You know, they're not dumb. So what do? They squeeze it and freeze it, turn it into frozen concentrated orange juice. Now it lasts forever. Now they can sell it as a commodity. They've turned a fruit into a commodity, so they can sell it on the commodities exchange. And there's no depreciation because it's got infinite shelf life. Good for them, bad for you. So that's the issue of fiber. Now, the other question you asked me, Steve, is about artificial sweeteners. So we're just going to take them as a whole. Okay, I'm not going to break down each of the artificial sweeteners because they all suffer from the same issue. Okay, and I don't care which one you pick. You can go all the way from stevia all the way up to aspartame and everything in between. I don't give a crap. Okay, the question is, are they good? The answer is half as bad. The toxicity of one Coca-Cola equals the toxicity of 2 Diet Coca-Colas. That's the way to think of it. We now have the data to show that from the American Journal of Clinical Nutrition 2018. Okay, 1 sugared Coke equals 2 Diet Cokes in terms of toxicity. Not good, just half as bad. Now, why should that be? After all, no fructose, no calories. Remember, it's not about calories, but no fructose. That should be good, right? Not so much. Here's why. You put something sweet on the tongue. Message goes tongue to brain. Sugar's coming. Message goes brain to pancreas. Sugar's coming. Get ready to release the insulin. But then the sugar never comes because it was a diet sweetener. What does the pancreas do? Does it go, oh man, I was waiting for that. I guess I'll just wait till tomorrow. Or does the pancreas go, you know, I was waiting all day for that sugar bolus and it ain't coming. I'm going to go find me some calories to go work on. And you end up overeating instead. And it turns out the answer is the second, the latter. We now have the data to show it's the latter. And so it's actually been shown that when you consume a diet soda, you get an insulin response, although it's a smaller insulin response. But what happens is that when you eat later in the day, you actually release more insulin. And so you drive more energy into fat and you create just as much chronic metabolic disease. So basically, it's like, you know, holding back the floodgates, but you can't hold it back forever. And so you end up with the same flood that you would have had anyway. And that's basically what happens. So ultimately, not a good answer. So half as bad. That's what the data show. Not good, half as bad.
Thanks very, very much for that. And up next, we're going to bring in a different Stephen. Let's go ahead and unmute. Hi, Stephen.
Hi, thank you for an excellent presentation. Really good. I guess a few quick questions. You know, there are glucose monitors, but I've never heard of an insulin monitor. And then the second question would be—
Working on it.
Okay, and then the second question would be, give me an example of how you might engineer a healthy processed food.
That's a good question. So first of all, insulin monitor, we are working on it. It's not easy to do because the concentrations of insulin in the interstitial fluid are so low. But we have the technology and we're working on adapting it. I'm working with a couple of companies right now to create a continuous online wearable insulin monitor to do just that, and to team it up with the glucose and also with ketones to be able to actually give you a readout in real time of your metabolic health and what's going on inside your body. And I think this will be a huge boon to this personalized nutrition field. It's a few years away. It's not, it's not tomorrow, but it's coming. Glucose we have now, and glucose is good, but it's not enough. It's not even remotely enough. And there are companies that I'm associated with, like for instance, Levels Health and Simplex Health, and a few other companies that look at glucose as being a primary driver of disease, which it is a primary driver of disease, but it's the insulin response that's the real primary driver. So the glucose is actually a proxy for the insulin. There's a book out just today, which I recommend to all of you. My colleague and good friend, Jesse Inshauspe, just wrote a book. You can find it on Amazon. It is called Glucose Revolution. Glucose Revolution. And it is practical tips on how to keep your blood glucose down. And if you keep your blood glucose down, that means you keep your insulin down. And that's the goal. Keep your insulin down. So take a look at that book. I recommend it highly. And I vetted all the science in it personally. How do you make processed food healthy? It's hard. Okay, it's hard. I'm not telling you it's not. It's hard. A team of 5 scientists, of which I am the head, has been working on KDD's portfolio for the last year and a half, very specifically to make specific changes in the added sugar. And we have sugar substitutes that are new, that are potentially even healthy, like for instance, allulose. There's another one out there called trehalose. We don't know enough about it yet, so we're not using that one. We are finding ways to put fiber into food in ways that are disguised, that people don't even know about. And I'm actually chief medical officer of a company that is developed a proprietary fiber that you take along with a processed food meal, and it will actually coat and envelop the processed food in your stomach so that it becomes unavailable for early absorption. In other words, we turn apple juice back into apples in the gut. And that company is called Biolumin. You can find that online, biolumin.tech. We are in clinical trials right now in order to be able to bring this to market. There are other things like adding omega-3s to food that didn't have omega-3s before. There are other things like knowing how many, what the heavy metal content and profile of the food is, and being able to actually source stuff that way. Getting rid of trans fats and omega-6s out of the diet, again, by sourcing appropriately. So there are a whole bunch of things that one can do to improve processed food. You can do it through ingredients. You can do it through the actual processing process itself. There's a company in Israel that can take juice, run the juice through a machine, and the machine has enzymes that will turn the glucose and the fructose and the sucrose into other things that are not dangerous, called better juice, that we're also looking at as a possible fix for the juice issue. So there are things that can be done using technology. There are ways to try to make things work. Obviously, anything that is done has to be vetted and has to be shown to be safe and to actually improve metabolic health. So none of these things are going to come out on the market until we're sure that they are actually doing what we say they are.
Thank you for all of that. And thank you for your question, Stephen. And whoops. Now we're going to move on to Deborah. Deborah, I'm going to go ahead and unmute you. Welcome.
Hi, I think it's me, Debbie M.
Yep, we got you, Debbie M. Thank you.
Okay. Yeah, I'll be honest, I didn't get to hear the whole lecture, so excuse me if I'm
You
just.
didn't? Oh no!
I'm sorry. I've been on this like every day since day one, but can't do every second. Listen, I'm just gonna be honest. This whole fruit thing is confusing me, listening to everyone, and I guess I just want to know, like, can we eat fruit? What fruit can we eat, and when can we eat it? And
So-
I don't have to juice it. I don't have to smoothie it, but it's like, it's
Right.
kind of pre-packaged, easy. You think it's healthy, and then I've heard that like grapes are engineered now to have too much sugar, and mangoes aren't good for you, and this raises your whatever levels. And I guess yeah.
Debbie, I'm gonna stop you there. I'm gonna give you a clinical vignette.
Mm.
Okay. My good friend and fellow cookbook author, I wrote a cookbook called The Fat Chance Cookbook. Okay, her name is Cindy Gershon. She is a wonderful lady. She used to weigh 100 pounds more, and she discovered all this stuff by her and ended up losing 100 pounds and keeping it off for the last 30 years. And she is a dynamo, and she is going to change the world all by herself. Okay. She gave up her restaurant to become a nutrition educator in the Mount Diablo Unified School District. How's that? All right. And she teaches the course to the students on food, science, and nutrition. And every year, the class starts with the same experiment. She takes 2 kids from the school, from the class, and these are poor kids. These are kids who basically don't even get breakfast at home, and they eat junk, on the way to school from, some convenience store or worse. Okay. She takes 2 kids from the class and she hands each one 6 oranges. And she says to the first kid, "Here, kid, here's 6 oranges. Make juice." The kid squeezes the 6 oranges, ends up with a 12-ounce glass of orange juice, drinks the whole glass of orange juice, and says, "Okay, what's for breakfast?" She then goes to the second kid and she says, "Here, kid, here's 6 oranges. Eat the 6 oranges." Kid eats orange number 1, orange number 2, orange number 3, gets to orange number 4 and throws up. She's got the vomit basin ready because they always throw up on orange number 4. And the kid goes, "Oh my God, I'm gonna die." And then the kid doesn't eat lunch or dinner either. What happened? Come on, Debbie, what happened?
Oh, I'm unmuted now. I don't know.
The fiber happened.
Oh, okay. All right.
The fiber happened.
He just got too much sugar.
No, the fiber happened. The first kid got this, it got 6 oranges worth of sugar. 6 oranges worth of sugar. The other kid threw up at orange number 4, didn't get as much. Okay, it's the fiber. The fiber basically acted as a satiety signal, moved the food through the intestine faster, greased the skids, if you will. Okay, that's one of the reasons why fiber is good for constipation, because it moves the food through the intestine faster, generated the satiety signal sooner, and the kid couldn't eat up to orange number 4. Fruit is self-limiting. The fiber reduces the rate of absorption of the glucose and fructose, so it protects your liver, and the fiber generates the satiety response sooner, so you don't overeat. So fruit is good because you can't overdose on it. Fruit juice is another story. Fruit juice is a disaster for all these reasons. And when you smoothie the fruit, you put it in the Vitamix or the Breville or whatever, okay, or the Magic Bullet, what happens is you have sheared the insoluble fiber, the cellulose, to smithereens. And now it can't develop that lattice work. Now it can't develop that fishnet that I described before. And so even though the soluble fiber is still there, the insoluble fiber is now gone because it can't serve that functional capacity of developing that lattice work to coat your duodenum. So you don't protect your liver. So fruit juice is better than soda, but it's not even remotely close to eating whole fruit. So can you eat fruit? Yes, just don't put it in the friggin' Vitamix.
Thank you very, very much for that. And we're going to now move on to Ruth has her hand up. Welcome, Ruth.
Hi. This is very, very interesting for sure. What about, okay, I just heard you talk about juices, but what about pomegranate juice, plain blueberry juice, and what's the other one? Cranberry, that they say are so healthy for you.
Yeah, I know. It's a marketing tool.
I know it's high in sugar because it says
it's very high in sugar. So yes, pomegranates and blueberries do have an increased amount of antioxidants. That's true. I don't argue that. All right. And a lot of companies have made a lot of hay over antioxidants, and antioxidants are good and they're necessary. And processed food is very low in antioxidants. So anything you can do to boost your antioxidant amount is good. So that's good. However, none of those juices that are available on the market are just pomegranate juice or blueberry juice. They're all, quote, fortified. They're all fortified with sugar to make them taste better, because blueberry juice itself is not all that good. And pomegranate juice actually is kind of bitter. So there's a lot of sugar that goes with it. So the question is the amount of antioxidants in those prepared juice drinks, because that's really what they are, they're juice drinks as opposed to juices, does the amount of antioxidant actually offset the amount of oxidation that the sugar that they had to add to make you drink it causes? And the answer is no. The sugar is worse than the antioxidant is better.
Thank you for that. And at the moment, and we do have a bit more time, so folks, if you've got other questions, please go ahead and raise your hand. Again, you can click on your reactions tab and we'll go ahead and see your hand raised. In fact, here's another one. In comes Ben. Ben, let me go ahead and unmute you. Thank you. Hi, Ben.
Thank you very much for giving me time to ask a question. I'm so like this lecture. I got one question because the insulin is growth the hormone. if insulin is too low, if patient has the wound, how can the wound, do you think this will affect the wound repair?
So insulin, you need insulin, okay? If you don't have insulin, you have type 1 diabetes, you end up in diabetic ketoacidosis, you become dehydrated and you die, okay? You need insulin, okay? You cannot live without insulin. That's why type 1 diabetics have to take insulin shots. Agreed. However, you only need the amount of insulin necessary to do the job. You don't need any more. More insulin means more chronic disease going forward. And insulin's been shown to be the driver of the growth phenomenon in your coronary arteries, in your breast tissue for breast cancer, in the brain. It causes metabolic dysfunction of the mitochondria in the astrocytes, and ultimately causes Alzheimer's, et cetera, et cetera. So the goal is to keep your insulin down, not get rid of it completely. But your body never gets rid of it completely. The goal is to reduce it to the absolute minimum to do the job. So there is a phenomenon called nutritional ketosis, and there is a phenomenon called diabetic ketoacidosis. They are not the same. Diabetic ketoacidosis means there's zero insulin. So the liver makes glucose, raises the glucose up to 800. You get, for 1600, you get sick, you get dehydrated, you die. Nutritional ketosis keeps your blood glucose around 60, and you don't die. And the reason is because people in nutritional ketosis still have insulin, just very little. All you need is just a little.
Excellent. Thank you for that. And now we have up next, go ahead and unmute Jackie. Hi, Jackie.
Yes, hello. Someone asked in the chat, I understand your point about juice, but what about smoothies? The fiber is still there. Did you talk about that?
I already answered that.
Okay.
The Vitamix, the Breville, shears the insoluble fiber to smithereens, so it can't create that gel on the inside of the intestine.
Ah, okay.
You still have the soluble fiber, which has benefits. I'm not saying it doesn't.
Okay.
Fiber does 6 things in your intestine that are good for you. 6. All right. I'll go through them real quick. All right. It reduces the rate of absorption, thereby keeping your glucose down. That's 1. Number 2, it reduces the rate of absorption, keeps your insulin down. That's 2. Number 3, it moves the food through the intestine faster, generating the peptide YY and satiety signals sooner. That's 3. It feeds your microbiome. That's 4. It generates short-chain fatty acids. That's 5. And it clears colon cancers from your colon. That's 6. Got it? 6 things fiber does that are good when it's intact fiber, both soluble and insoluble. If you consume soluble fiber alone, like inulin and pectin, all right, that would be, say, a Breville, or Vitamix, because you've destroyed the insoluble fiber. It will do 2 of the 6. It will feed the microbiome, and it will generate short-chain fatty acids. That's good. I'm not saying that's bad. That's good. It's better than 0, but you only get 2. If you ate cardboard, which is insoluble fiber, but no soluble, you would also get 2. You would basically move the food through the intestine faster, and you would clear colon cancer cells. Insoluble fiber, 2. Soluble fiber, 2. The 2 together, 6. What would you rather do, Jackie?
I get it.
Thank you.
Thanks, Jackie. And now we're going to bring in Ed. Ed, I am unmuting you now and welcome. Hi, Ed.
Hi, I can you hear me?
We got you.
I can hear you.
Okay. Thank you very much. I mean, I remember hearing you speak decades ago on sugar. And I'm glad you put the work far along now.
Yep.
Going back to the green smoothie, you know, we drink it because it's a way of getting our vegetables, since it's difficult to eat that much greens.
Right. So
Now,
the greens,
if we add fiber back into it, say in the form of wheat bran or sugarcane fiber stuff, I know it's not the same as eating a whole food, but does that go a long ways to mitigating the shared fiber?
the green smoothie doesn't have very much sugar in it at all, because that's why it's green. Right? So you don't have to protect your liver, because there's nothing to protect your liver from. So if you're going to, if you want to eat your vegetables by making green smoothies, have at it. You know, I don't see the point personally, but if that's what you want to do, sure. But fruit smoothies are another story, because now you've got the sugar load, and what's going to inhibit the absorption of that sugar load to keep that glucose spike and that insulin spike and that fructose from turning into fat in your liver. What's going to stop that? Okay.
Excellent. Thank you very, very much for that and clarifying that. And now we're going to bring in Kaylee. Hi, Kaylee.
Hi. Please, what is the best way to eat a lot of sprouts?
A lot of what?
Sprouts.
Sprouts?
Sprouts.
What do you mean? What's the best way?
Well, I had been putting them into smoothies along with blueberries and other things.
Well,
but now,
like I said, as soon as you turn it into a fruit smoothie, it's a problem.
what's the best way to get them down, to eat them? If they have, do they have a lot of reasons are they full of micronutrients to eat them? Is that something that?
Sure. I mean, there's sprouted bread in the store. You can make a salad. I mean, there are a lot of ways to do it. I mean, if you want to make a vegetable smoothie and add sprouts to that, I mean, the micronutrients are still there. If that's the goal, is to get the micronutrients, you can put it in a green smoothie. But, as soon as you make it a fruit smoothie, it's a problem.
Got it. Thank you again for that. And looks like Ruth is back. Let's go ahead and unmute you. Hi again, Ruth.
Hi. I've got 3 bottles that I just took out of the fridge right here. Back to the cranberry by Black River, which is pure organic cranberry juice. And there's only 10 grams of sugar in here. And it doesn't say that they've added anything.
Okay.
They said undiluted.
You know what else has 10 grams of sugar?
What?
Captain Crunch.
Okay, so you're saying it's too much. I mean, I'm gonna have to either throw all these. They've been in my fridge for a while, and I take about a quarter of a cup at a time. And also, okay, in the future, I'm thinking I'm not going to buy these when it's not from concentrate. Does that make a difference?
Nope. That'll make a difference.
Okay. So, all right. So even 10 grams compared to the 22 grams. I mean,
how many grams of sugar are you allowed per day?
I don't know.
American Heart Association says for women, 25 max per day. For men, 37 and a half. Okay. So if that juice is giving you 10 and you're allowed 25, that only leaves you 15 for the rest of the day. You okay with that?
What's a serving? What is a serving?
Depends on what it is.
Like this juice.
Well, that's 10 grams.
1 cup. Oh yeah. 1 cup is 10 grams.
Duh.
Okay.
That's the point. The whole point of this talk is it's everywhere and you don't even know it.
And the honey, I'm sorry, you may have talked about this. I wasn't
Honey
able
is-
to get there.
Honey is sucrose. It's the same thing. It's glucose and fructose. No difference. Everyone thinks honey is safe. It's not. It's the same thing.
So the manuka
So
doesn't make any
the
difference.
good thing about honey, is it has its own taste and it's relatively expensive. And so people tend to use less of it. That's true. By the way, honey, if you don't buy the really, really expensive honey, is probably just high fructose corn syrup. Honey fraud is one of the biggest fraud items in the entire food world. And I have a colleague named Mitchell Weinberg, who actually has developed a certification system for honey called Genu Honey to make sure that people are actually getting honey and not high fructose corn syrup. If you're buying cheap honey at the store, chances are it's not honey.
Thank you very much for that. A quick follow-up. You mentioned the guidelines, just out of curiosity. Okay, so those are the guidelines. Do you agree with the level of guidelines, the guideline level?
Which guidelines?
Well, exactly. Specifically, the sugar guidelines that you mentioned for men and women.
Yeah, and I helped write them.
Oh, okay.
I better think it's okay. What I don't think is okay is the USDA's guidelines. And because the food industry got to them, and they're, they say 10%, which is like 12 teaspoons as opposed to 6 or 9. So they basically say double of what is actually safe.
Got it. Thank you for clarifying that. And now I'm going to bring in Crystal. Crystal, you are unmuted. Welcome.
Oh, thank you so much. Dr. Lustig, you are phenomenal. I've been following you a long time, just listening to you speak on UCTV and deliver powerful, powerful presentations. And particularly, I want to thank you for the work that you're doing in the African American community and other communities of color, because we tend to be ignored and maybe underserved and just kind of overlooked and whatever else you want to, whatever the superlative you can come up with. But in any event.
Ms. Perry, I am a pediatrician,
Mhm.
and I believe that everyone deserves a chance. And I am sickened. Lived in Memphis, Tennessee, and I am sickened by the fact that the African American and Latino communities are abused by the food industry.
You're going to make me cry.
I want to fix it. It's one of the reasons I do what I do.
Wow. I'm sending you a virtual hug through the through this Zoom, because it's people like you that have a voice that can make an impact. And even though it takes a long time to turn around a 90-mile-an-hour train,
Yep.
You're doing everything within your capability and your power to do so. And I just want to commend you for the work that you do. Thank you.
I do appreciate it, but I will tell you that I need your help, because there are a lot of people in the African American community who are sugar addicts.
Yes.
And
Yes.
who don't want to hear this message.
Yes, I agree with you. I am studying to become certified to coach on nutrition. And it's hard when you're dealing with your immediate family members. They're the ones that listen to you the least, because they feel like you don't really know what you're talking about. And they give you this excuse of, well, I'm going to die of something. I might as well die enjoying what I love.
Yeah,
but they don't
hear that all the time. I hear that. Let me tell you a quick story.
Okay.
We have time for a story, right, Ben?
Absolutely.
In the year 2000, a while ago, I lived in Memphis, Tennessee, right? I told you about that. And I was a member of a professional organization called MASPN, Memphis Area Society of Parenteral and Enteral Nutrition.
Mm-hmm.
And we got an audience with the Memphis Board of Aldermen to go and talk about why there were no supermarkets in the area of Memphis called Orange Mound, which was the poorest section near the airport. Okay, because all they had was Popeye's fried chicken and stores with Coca-Cola and Twinkies. That was their, that was all there was. And we went to, there were fast food restaurants, but there was like
Well,
a supermarket. So we went to the Memphis area, we went to the Memphis Board of Aldermen, and we stated our case. And there were 17 aldermen up on this dais, and the head of it looked down through his glasses, his long nose and his mustache. And he said to us something that I couldn't answer. He said, "You want to take away the single thing in these people's lives that give them pleasure?" I didn't have an answer for that. And we walked away, and of course, nothing was done. I have an answer for it now, but I didn't know enough back then to be able to counter that properly. The point is, to a point, he's right, except pleasure is the wrong arbiter. It's not about pleasure. It's about happiness. And pleasure and happiness are not the same. And I wrote an entire book on the fact that pleasure and happiness are not the same. It's called The Hacking of the American Mind. And we talk about dopamine, which is pleasure, and happiness, which is serotonin. We talk about the fact that the more pleasure you seek, the more unhappy you get. And that is called addiction. And sugar is addicting.
And with that, Crystal, I'm also curious, do you have a specific question as well? Oh, hang on. I think somehow I muted you by accident. Okay. Yeah, Crystal.
Yeah, you muted me. That's fine.
Sorry about that.
No worries, no worries. Very quickly, there's so many people that mentioned the whole smoothie thing, green smoothies versus fruit smoothies. I happen to do green smoothies periodically, and I have heeded your warning about what these machines do to destroy the fiber. Because I do add fruit to it. I add like a half a cup of frozen blueberries and 5 strawberries.
Well, that makes it not a green smoothie anymore.
Exactly. So I think that for myself and others who are doing the smoothie thing, we may need to revisit another way to do that. I don't know if just making a straight green smoothie with water and greens, and then maybe mixing in a tablespoon or 2 of some type of fiber, powdered fiber.
After the smoothie is done.
After.
Yeah.
I don't know if that's a possibility. That's my question.
Well, so, you can add Metamucil, but that's only soluble fiber. And like I said, soluble fiber is good. It's not bad. It's just not enough. You only get 2 of the 6 benefits.
Right.
And there's no insoluble fiber you can add, at least not yet. Hopefully, when our product Biolumin, comes online, then you will be able to.
Okay, Biolumin. And if I wanted to get more information about that, do I just need to go to your website?
No, biolumin.tech.
Okay, biolumin.tech. Okay, perfect. Thank you so much.
You're very welcome.
Thanks very much, Crystal. And I'm going to go ahead and bring up now Melissa. Hi, Melissa.
Hi, thanks so much. It was really informative. So don't cringe, but here's my question. How do you feel about a date or 2 in your breakfast oats a few days a week and or figs, like 3 or 4 organic figs once, twice a week as a treat?
So when you said, how do you feel about a date or 2? I thought you were asking me out.
I saw your wedding ring, so I knew it was out of the question.
So dates and figs are relatively high in sugar. They have some fiber, but they are relatively high in sugar. But if they're rare, like once or twice a week, it's fine. It's terrific. People always say, attack me. Let me make it very clear. I am for dessert. For dessert. I am not for dessert for breakfast, lunch, snacks, and dinner. All right. And right now, everyone's having dessert for breakfast and dessert for lunch and dessert for dinner. If you are having Chinese chicken salad for lunch, you are having dessert. That's dessert. That's not a chicken salad. That is dessert. Okay, all you have to do is look at the amount of sugar in a Chinese chicken salad, and you will understand why I say that. All right. Now take the National School Breakfast Program, which 29% of children currently are enrolled in. Okay. What is a standard National School Breakfast Program breakfast? A bowl of Fruit Loops and a glass of orange juice. That is 41 grams of sugar. The American Heart Association says that for children, the upper limit for sugar should be 3 teaspoons or 12 grams of sugar for the whole day. This is 41 grams of sugar. So it's more than triple the limit, and it's just breakfast. You want to know what's wrong? That's what's wrong. Now, if you're having a date or two or a fig or two in a bowl of otherwise savory cereal like muesli that hasn't been oversweetened, and that's what you use to sweeten it, and it's once or twice a week, hey, have at it. No problem. That's dessert. No problem. As long as it's safe and rare.
Excellent. Thank you very, very much for that, Doctor. Folks, just a friendly reminder, we have a few more minutes, and if anybody else wants to raise their hand, we'd love to take your questions. This is really a remarkable opportunity for us, so please go ahead and raise your hand. In the meantime, I've got a question.
Sure.
A little bit, not exactly, a little bit off topic. Before I get there, it looks like we've got Stephen back, so let's go ahead and get to Stephen. Stephen, welcome.
Yeah. Okay, thanks. You know, again, this is my second or third question, but just a great presentation, and thank you.
Thank you.
So my question to you now is, what do you eat for breakfast, lunch, and dinner?
You're not allowed to know. Serious. People always ask me, and it's kind of, I'll tell you what I normally have. I usually have some whitefish salad on a crisp bread. Does that help? That's a standard breakfast for me. Trader Joe's crisp bread, because I'm wheat free, and those are wheat free, and whitefish salad that my wife gets at Costco. That's what I have.
What about lunch and dinner?
I knew you were going to ask that. Again, you're not allowed to know. I'm not the food police, and I eat well, and I am mindful of what I eat.
We can go right ahead and leave it right there, and thanks for that. And so again, I'll jump into this question that I had. Bear with me. It's a statement by Dr. John Abramson. And Dr. John Abramson wrote, "The pharmaceutical companies now control most of the medical research agenda, and their primary goal is not to improve Americans' health, but to maximize their own profits, which they do masterfully. To that end, they control the design, conduct, and analysis of most clinical research, and they largely control the delivery of the results of that research across the entire spectrum, from the most respected peer-reviewed medical journals to all those annoying drug ads on television. Although the supposed purpose of this information is to educate doctors and the public, it is, truth be told, carefully curated to disseminate key marketing messages designed to maximize drug sales." And so the question is, do you agree with all of this?
Absolutely, 110%. I totally agree with it. And I assume that's what we're going to be talking about at 4 o'clock or 5 o'clock, whatever time it is. 4 o'clock, I think. Right?
Got it. Depending on where you are.
And that's why the book, it says modern medicine there. I've got a whole chapter on Big Pharma and, what their role in this debacle is. Yes, the food industry are the bad guys, but Big Pharma have been the enablers without question.
Got it. Let me just double check if there's any other. It says we don't have another raised hand. Again, folks, a few more minutes. If you want to raise your hand, we'd love to have you come in with a question. I've got another question for you. Again, just a little bit slightly off topic, but what's wrong with clinical trials? And should we assume their information is accurate and unbiased?
Well, first of all, you have to make sure that the clinical trial is actually conducted properly, and a lot of them are not. That's number one. Number two, you have to make sure that you control for all the variables, and a lot of times you're not. Another thing is when you do a clinical trial, sometimes you're evaluating not just one thing against placebo, but two things against placebo. Well, if you're going to evaluate two things against placebo, which often happens in a clinical trial, then you have to evaluate one against the other, not just against the placebo. Okay, so there are all sorts of rules for the statistical analysis of clinical trials which are not followed. The genius statistician doctor who I refer everybody to understand what's wrong with our clinical trial paradigm is Dr. John Ioannidis at Stanford. He's like, got the best handle on what's gone wrong in clinical trials. Now, the problem also is understanding the difference in relative risk reduction versus absolute risk reduction versus number needed to treat. These are three separate outcome variables that can be determined from a clinical trial. Invariably, the pharmaceutical company will use whichever one of those three makes their drug look best. And that's bullshit. And that's not the way you do it. All right. There are a whole bunch of things that, can be done to manipulate drug trials so that they look better than they are. For instance, statins. As we talked about, statins, people think statins work. Not so much. And it's, partly because the statin companies doing this, basically, lying with statistics.
Thank you very much for that. We do have another raised hand, so I'm going to go back to Monty. Let's go ahead. Hi, Monty.
I just missed this presentation, but I heard you talking about honey, which is one of something I have a lot to do with because they do beekeeping. But the biblical account of honey doesn't make any reference to drinking or using honey in liquid form. Is it any safer to eat the honey, since the Bible says eating honey is good? Because it constitutes the fiber and the comb and the works. Does it make the release of sugar in the blood less or slower?
No. So the studies on honey are, for the most part, done by industry. So that's a big problem all by itself. Because if it's industry sponsored, they're only going to provide the data that makes their product look good. That's number one. Number two, a lot of marketing info on honey says, oh, it's got micronutrients and it's got, natural antibiotics and all this stuff. The studies that have been done independently demonstrate no meaningful effect of those things on any parameter that we can measure or study. Otherwise, honey's just glucose and fructose. It's just sucrose. It's just like sugar. The good news is because it is thick, because it dissolves relatively poorly, you don't tend to use very much of it, and because it's expensive if it's real honey. So all those things make honey a little bit better, but not really. I mean, gram for gram, ounce for ounce, it's just sugar.
Thanks, Dr. Lustig. And let me go ahead and again, I don't see a hand at this point, but I've got another question for you.
Well, it's got to be a 3-minute question there, Ben.
You said it. I agree. We're on the same page. In fact, we'll make it 2 minutes. And again, a little bit off topic, but I'm curious your thoughts on colonoscopies. Do they save lives?
Colonoscopy?
Yeah.
Sure. Oh, yeah. No, they save lives. Absolutely. Okay. Colonoscopy is one of the good screening tests, and I'm due for mine.
If that's one of the good screening tests, what are some of the not so good screening tests?
PSA doesn't work. Okay, so some screening tests are good, some screening tests are bad. They're working on screening tests, they're, liquid biopsies and a whole bunch of other, newfangled things to look at blood tests or look at DNA and, in the blood. of foreign antigens and things like that. So there are other things, there are things coming along. And it's not that modern medicine is useless. Modern medicine is good. It's just that modern medicine lost its way when it comes to chronic disease. And the reason is because chronic disease is mitochondrial disease, and there are no medicines that get to the mitochondria. Only food does. But food can either help the mitochondria, like glucose, or it can hurt the mitochondria, like fructose. So not all food is medicine. Some food is poison.
I think we're going to take it from there. And thank you so much, folks. I see a couple more raised hands. At this point, we're going to close and get ready for our next lecture. Dr. Lustig, this has been eye-opening and profound and thought-provoking, and something I think we all needed to hear. And so I thank you very deeply for all of your time and your
Pleasure.
Graciousness with all of this Q&A as well. I am not the only person, I am certain, that wants to thank you. So we're going to have our tech team unmute our entire audience. What does everybody want to say to Dr. Lustig?
Thank you very much.
Awesome.
Thank you, Doc.
I love that.